Hey, beautiful. I'm hopping on here for a quick solo episode to just talk about some things that I've been noticing a lot in my practice lately. So, this is particularly for the woman who is in her 30s and wondering if she's running out of time to get pregnant. This is something that I hear from so many women who come to my practice, who reach out to me online. And I think this is worth a quick, really real conversation. And I want to start with a patient story, actually, because I just saw one of my dear patients this week. She's someone that I've seen for a few years now, and she came back to me recently. After some time, she'd been feeling really good. We had done work together, and she was feeling amazing. And slowly over time, when she wasn't coming to see me, things kind of backslid a little bit. So she wanted to readdress those. And she also suddenly had this insight at 35 that, hey, maybe I should check in on my fertility. For the first time in her life, she was feeling like, okay, maybe I want to have kids and I want to know what my timeline looks like. So we did her testing. We started actually with just, very simple blood work, nothing too crazy in terms of our functional testing, but really got a comprehensive look at her health. And with that, we included AMH, anti-Mullerian hormone, which, if you're not familiar, is basically a hormone that's secreted by our ovaries from developing eggs. And it is used as basically a measure of quote unquote how many eggs we have left. It is not, I always do such obvious air quotes with this. It is not a black and white perfect answer with that, but it's something that gives us insight. And up until now, we haven't had anything better than that. The other tests that we use to look at, again, are we getting close to perimenopause? We look at hormone levels, but that doesn't tell that much of the story. We also look at sometimes an antral follicle count, which is an ultrasound, which can also look at, again, the number of almost like premature eggs that are being stored in our ovaries of, again, how many are there? How many are left? So for this patient, we looked at AMH along with her other numbers, and when we got those results back, her AMH was low. Unfortunately, low even compared to her age. AMH is something that does decline with age, particularly from, say 30 to 40. We're seeing a pretty steady drop in it typically, but hers was lower than we'd expect. Now, she also had other things going on with her blood work that can absolutely impact that. For one, low vitamin D, very low vitamin D, and we know that vitamin D can absolutely impact AMH levels. Also, she has had chronically low iron and ferritin, and this is something that in the past we had addressed and normalized, at least gotten it back on track, but then it has dropped again. And so that's something that, both of those things can absolutely impact AMH levels along with other things. So we had this really beautiful conversation about how these levels play in together, what it's really telling us, how I expect them to change based on optimizing those other levels. And I just wanted to come on here to also share this conversation because I realized that it is such a nuanced conversation that most women are not getting. They're not getting the realness of it. They're hearing these hooks on Instagram that are maybe kind of having a lot of shock value, but aren't really telling the whole story. So I wanted to come in here and have this be a very realistic conversation. So, that was our experience with that patient. She, again, now we're going to be addressing her iron status again, her vitamin D, and rechecking all of those things along with AMH to see how that changes. And we've started to see the conversation too of what does it look like to have kids in a non-traditional way. She doesn't have a partner yet. She doesn't have a clear plan, but starting to say, okay, if this continues to be low, if we are looking at potentially, perimenopause coming in and, that fertile span closing, that time frame closing, what does that look like? And one of the things that really stood out to me with this experience, and it's been coming up more and more with my patients, is when do we check these things? Because with her, for example, again, I've been seeing her for a few years, but this was never part of her concern. Of course, it's part of what I do with a lot of my patients, but for her, it was something completely different. The iron has been an issue for a long time. She had fatigue, and that's what we initially discovered, and something that we were, again, working on and correcting. But this wasn't part of her priorities and her goal. And it's not something that I usually check on people who don't have this as a goal, AMH that is, because it can come with a lot of feelings about it. It can be charged, but this is changing my perspective on it personally, as a doctor who's guiding women in this. More and more, I'm feeling like it's something worth checking as early as possible. I've had too many patients at this point, unfortunately, that got blindsided by early menopause, by early perimenopause symptoms, running out of time and having that window close on them before they were ready. And it is heartbreaking. It is heartbreaking for a woman to experience, even if she isn't planning on having kids. Again, I've had so many patients who experience this and they're like, okay, I didn't want to have them, but I wanted to have the choice at least. Having to give that up without an option can feel so devastating. And while checking our fertility can feel scary, and seeing that timeline can feel like, well, I don't want to know. I don't want to know. I don't want to have to worry about it right now. Trust me when I say it's better to look at it now and have a clear plan, have a clear process that you can do to still have some impact on it, rather than finding out when you're already trying, you're already struggling, you're already, so in the weeds with it, and then finding out actually you're out of time. It is so hard, even for me as their doctor and their guide. Again, I've got skin in the game too, because I really truly care about my patients. And when they have to deal with this, and I feel sometimes like a failure too, where I know that I did my best and I know that I used my best clinical judgment in what we were doing. But man, I'm like, oh, I kick myself sometimes wishing that we had just checked something earlier so that we had known, because maybe we didn't have warning signs. I've had other women who, they're going into their 40s, they're cycling fantastically. They don't have any symptoms of perimenopause. They're good. And I'm like, yeah, I absolutely think that you have time, but let's check on things. And suddenly they're like, oh, in the same time frame that we're checking blood work, all of a sudden they're like, oh, my cycle started getting really weird. Oh, I'm starting to have these symptoms. And again, maybe we check their AMH and it's just so low already. It's like, damn, that sucks, because we're out of our control. We're out of any sort of power to change things. Whereas if we check them earlier, we do have the ability to change things to some degree. Maybe not 100%, like, hey, instead of going into perimenopause at, 40, you're going to go into it at 50. Maybe that's not completely realistic, but we can absolutely buy at least several years, in my opinion, to be able to, again, extend that window out, have really healthy babies, healthy pregnancies, because that can also be a factor with having kids in our later 30s and 40s. We can absolutely change the environment of our body and change the aging process on our ovaries, as long as we're not already too late when we do that. So I hope you found this helpful. I really would love to hear if you have questions about this. Please reach out to me on Instagram at Dr. Miranda Naylor, or you can send me a message, you can email me. I would love to hear if you have questions or thoughts about this, because again, I feel like this is such it can be a beautiful opportunity that we have, but it can also be a really tough, scary point in our health when we don't know. It's a very big unknown when we're just not sure if we're going to run out of time. We're not sure if we're going to have issues getting pregnant or staying pregnant. So please, please, please reach out. I'm also happy to support you if you're concerned about this, if you want to check on your numbers. We have so much power again in what we can look at, what we can change, and the earlier the better on this. So I would be happy to support you in this. And I love talking about this and supporting women through this.